Welcome. I am Julie Terode of the Institute of Cancer Policy, King's College London, and the current Vice President Europe of the Executive Council of the African Organization for Research and Training in Cancer, more familiarly known as AORTIC. I'm joined here today by the President of AORTIC, Dr. Cecil Tina Lorenzoni, and the Director of the International Agency for Research in Cancer, or IARC, Dr. Elisabetta Weidepas. Thank you both for joining me. Elisabetta, congratulations on the successful IARC at 60 anniversary conference in May 2026. I was very pleased to see so many young African researchers there presenting their work. What were your impressions?
It was a wonderful event, Julie, and we were also very happy to have the AORTIC present and to sign our memorandum of understanding during this remarkable event. I think it makes the event even more special, both for us at IARC, but also for the AORTIC community.
Yes, absolutely. And so, as you say, during the conference, you both signed a memorandum of understanding, launching a partnership between IARC and AORTIC. The partnership sets out 4 objectives. Firstly, to develop stronger ties between the leaders of both organizations. Secondly, to establish the IARC AORTIC webinar series, which is due to kick off in September 2026. Third, we'd like to build on the IARC AORTIC roundtable that was held at the AORTIC conference last year, and explore closer collaboration between our organizations in support of young cancer researchers in Africa. And fourth, perhaps in the coming months, start to develop a plan for an African code against cancer. So I would encourage African researchers to join AORTIC and help us develop this partnership for maximum impact. Elisabetta, championing partnerships has been very much a feature of your tenure as director at IARC. Can I ask you, why is research so critical for shaping cancer prevention and control in Africa?
Thanks for this important question, Julie. Research is essential because it helps us understand what really works. Africa is a diverse continent, and global data is not always enough. We need local research to really understand what is happening on the ground. It helps us identify the main risk factors, see where the needs are, and design solutions that fit communities for whom they are intended. Research is also key in improving health systems. It helps us find practical ways to deal with challenges like late diagnosis or limited access to care. And most importantly, it helps us move from ideas to real action. So in the end, investing in research means better decision-making, better strategies, and better outcomes for patients.
Thank you, Elisabetta. You lead the cancer plan for the Ministry of Health in Mozambique, and of course, you're also a dedicated pathologist. But from the perspective of AORTIC, Cecil Tina, the same question to you. Why is research so critical for shaping cancer prevention and control in Africa?
Thank you, Julie, for this opportunity. And also thank you, Dr. Elisabetta, to this opportunity to collaborate with IARC. During the 16th anniversary, it was a great pleasure to meet with you and to enforce our collaboration between AORTIC and IARC. About the research, it's very, very critical for shaping cancer prevention and control in Africa. As you know, the continent of Africa faces a unique and rapidly growing cancer burden that cannot be addressed solely with data or solutions from other parts of the world. We need greater understanding of the unique epidemiological pattern and distinct risk factors. As you know, for example, cancer across Africa is highly linked to infectious agents such as HPV, hepatitis B, HIV, which account for up to 30% of cases in some regions, a much higher proportion than in most other nations. The continent has also an acceptable high cancer mortality rate, around 70%, primarily due to late presentation and also about the limited access to early diagnosis, requiring local-led implementation research into building public knowledge and readiness to act, timely detection strategy, and feasible models of care for our community. Also, African population are also the most genetically diverse in the world. Conversely, we are fully represented in the international research to date. We are building our local capacity so that we can lead African oncogenetic research and to understand how these factors contribute to cancer development.
Thank you. Some clear messages there, Ceciltina. Could you also respond to my second question? How do you see the IARC-AORTIC partnership strengthening research capacities and outputs that are specific to the African community? I think you've addressed that a little bit in your first response.
Yeah, as I told before, during our meeting, we reinforced our partnership. And I think that we need to stimulate the researchers to take a 360-degree look at the cancer and explore basic, translational, and implementation science that provide policymakers and the public with the evidence for filling the cancer surveillance gaps regarding basic data on cancer incidence, geographic distribution, and risk factor prevalence. Cancer registry and the data they generated local is crucial to create the national cancer control plans that are effective, targeted, and evidence-based. Overcoming barriers in delivering cancer prevention and control service in our communities, noting the diversity, geographically challenged, and cultural needs that should be respected. Also, identifying the most cost-effective and sustainable intervention suitable for limited resource setting, with innovation for our local context. The partnership with IARC will also guide us in the building of sustainable research infrastructure, fostering local research leadership, and create a sustainable local expertise, noting the stimulus to development that strong research systems bring with it, contributing to broader economic and educational benefits.
Thank you. Oh, that's a long list, Elizabeth. Let's go close with you. What strengths in particular does IARC bring to this partnership, and how do you see those responding to the long list that Ceciltina has? What things will particularly strengthen research capacities and outputs for the African communities? Oh, you're on mute there, Elizabeth.
So IARC brings global expertise, and AORTIC brings the regional leadership and deep knowledge on the continent. So together, I think both IARC and AORTIC can support researchers, encourage collaboration, and help building the skills needed to carry on high-quality research to respond to local priorities. An important point is that research should not just be produced, it needs to be used. And it has to inform policies and improve what happens on the ground. So the webinar series is a good example of this. It creates a space where we can share knowledge, highlight African-led research, and connect people across disciplines. In the end, this partnership is about building a stronger and more connected research community that can better respond to the needs of African populations.
Thank you very much, Elizabeth. I really like that idea of a better connected research network. And of course, as a cancer advocate, focusing on translating that to policy and action, very important. So thank you both for joining me. This is a short teaser to build interest in the joint work coming up. We've already conducted a roundtable, as I mentioned, at the AORTIC 2025 conference, and we're now building on that with this joint webinar series. So take a look at our save the date and register to be part of these future dialogues. Thank you very much.
Thank you. Bye.